Hi everyone, my name is Heather Happy and I'm a licensed esthetician at Cool Springs Plastic Surgery, and September is our Saiton BBL and laser month. So all month of September we're going to be having great packages with discounts. These are going to be the biggest discounts of the year. So I just want to let you know some things that you're going to find during our time together. We're going to have different segments. They're going to be broken into sections that are going to talk about before, during, and after the treatment, the consultation itself, what to expect with the treatment, things about BBL, halo, and nano laser peels individually. We'll also talk about surgical combinations and injectable combinations. So there's going to be lots of information in each section. So I hope you're able to stay tuned. And the next thing we're going to talk about are things to consider before and during your treatment. Okay, so next we're going to talk about things to consider before your treatment, before your appointment, and then I'll also talk a little bit about what to expect during your treatment. So if you're new to us, we do require a consultation before you schedule any kind of a BBL or halo or laser treatment. We just have to make sure that it's right for you, for your lifestyle, your expectation, your budget, things like that. So if you are new to us, you do need to have a consultation, or if you're an existing patient and we've never talked to you about this before, we do need to see you. If you are a repeat patient that we have already done BBLs and halos on in the past, you might just want to shoot us a text or an email to just say, hey, let me just run over the things that we need to talk about beforehand. Which package should I buy? And then we can just do that either via phone call, text, or email. So what you're going to expect, first of all, with a consultation. You come into the office. If you're brand new, you have to fill out some paperwork. But you're going to come in. We're going to sit down and talk about the skin concerns you have. It could be a collection of things. We could talk about the redness in your skin, rosacea, broken facial vessels, acne, large pores, excessively oily skin, brown pigment or excess brown pigment like freckles or sun damage, lines and wrinkles, texture, scars. There are lots and lots of things that we see patients for in the office. So once I narrow down what your top priorities are, then I'm going to go ahead and give you a treatment plan. And that treatment plan will most likely consist of some products that you can use at home, especially if you have a very minimal routine. I'm going to suggest some products. If you have an excellent skincare routine, I'm probably not going to change anything. I might just add one or two things, but skincare products are going to be part of the conversation. And then we also talk about treatment possibilities. So if you have a collection of things that you want to address, honestly, BBL, if you're a candidate for that, and halo could address a lot of concerns. However, there are things with your lifestyle, social schedule, things like that, that they may not fit into your schedule. So then we will talk about alternative treatments. I do like to give 2 to 4 treatment options for every patient that's going to address the concerns you have. I want to tell you treatment options that are going to work for your lifestyle, the downtime that you're going to let me have for you, budget, expectations, what your long-term result is going to be, how much time you're giving me to fix things. So we are going to talk about other options that you can have, although BBL and halo might be a really good option for you. So that's what we're going to discuss. Now, whenever we decide on your treatment, whether it's a BBL or the halo, and we'll talk about that in depth later on in other segments, but the first thing you're going to do when you come in is I'm going to take your picture. So we have to have your photo on the chart because it's part of the medical record, but we also need to see and track the progress of how you've done from the base appointment or the foundation where we've done nothing to you, and then track you as you're going through the process. So we'll take photos first. Consent forms, I typically, if I'm doing a lot of treatments, I will typically either email you consent forms or give them to you at the consultation appointment to take home and look at. I don't want you to sign them and bring them back. I just want you to pore over them because it is a wordy consent form no matter which one it is. And I want you to make sure that you have read and understand everything, and then you have an opportunity to ask me questions before you get to your appointment. Because honestly, sometimes I've had patients that have sat in an hour appointment and for 45 minutes read a consent form, and I don't have time then to do the treatment. So I might send you the consent forms. That's a possibility. So once you've signed them in the office, then I go ahead and explain the entire procedure, or one of our providers, whoever's doing your treatment, we explain the procedure. If it's a BBL, we explain exactly what you're going to expect right before the treatment happens. The BBL itself is a little bit uncomfortable, so we do have some tips and tricks that we can do to make it a lot more tolerable for you, and we give you those options. And then when you're finished with that treatment, we tell you exactly what you're supposed to do and then let you go. With the halo, it's a lot more in-depth, so there is a lot more explanation of the treatment before we get started. But just know that whoever is doing your treatment, we are an absolute expert at running that room, and we can do everything that's needed in the room. You just need to just kind of lay down, relax, take a couple of breaths, and just let us do our job. And we will 100% take good care of you and make sure that your anxiety is calmed down and that you feel comfortable with the treatment, because it is nerve-wracking. It is a little scary to get things done that you've never had before. So that's pretty much going to be what you expect during the treatment. When you are finished, like I said, especially for the BBL, but the halo as well, we will give you full information about what you're to do with your skin, when we want to see you back, because oftentimes some of these treatments are done in a series. So we'll let you know, hey, we want to see you back in X amount of time. We give you our contact information, our cell phone numbers, our email addresses that you can contact us if you have any questions or concerns. But that's pretty much what you're going to expect during the treatment. And then we'll plan out when we see you again, whether it's just for a follow-up or your next treatment. We'll decide that at that appointment. As always, if you have any questions, you just have to let us know. So the next segment coming up is going to be talking about the halo, which is one of my favorite treatments to do. So we'll talk all about that in just a moment. All right, everyone. So the first treatment we're going to talk about is the halo. So I want to just tell you what the halo is, how it's going to be a little bit different or really different from the BBL. First of all, the device that we use is called the Saiton, and halo and BBL are branded to Saiton. So when you hear things about laser treatments or IPL treatments, which we'll talk about that with BBL, those are just kind of generic terms, and each laser company has their own branding. So the way I kind of discuss it is halo or BBL is a branded version, kind of like Coke or Pepsi. So whenever you hear those terms, just know that if somebody says halo or BBL, they're talking about the Saiton device. So the halo, what is it? It is a hybrid laser. So that means it has two different wavelengths that will function at the same time, and they're both working on something differently, but at the same time. So there's a very deep wavelength and there's a more superficial wavelength. So what we do is, once I decide from your consultation, and then I reiterate your priorities when you come in for the halo treatment, once I find out what your priorities are, then I'm going to be able to tune and customize your halo treatment specifically for those priorities. So if you really want to work on brown pigment or excess brown pigment, then I have to customize the settings for that. If you want to work on scarring, deep flushing with rosacea, texture, deep sun damage, then I have to customize it to that. So sometimes if you have a lot of things you want to work on, you might need more than one halo treatment. So anyway, the halo is an actual laser. Now the laser itself is incredibly fine-tuned that it finds one specific target. So the thing I like to kind of explain it to patients is, if you're using like a red laser pointer in a board meeting or a presentation, or playing with a cat and having them chase it around, that's like what the laser is. It's very defined, very precise. BBL, which we'll talk about in just a moment, is light that just kind of goes everywhere, somewhat like a flashlight or like a strobe light. So they're very, very different. The halo is fine-tuned for very specific treatments. Now, the benefits of the halo, I can treat everything that I mentioned: scars, flushing, sun damage, deep sun damage, lines and wrinkles, pores. We can treat almost everything on your list with the halo, but not everybody is going to be a perfect candidate. Now, what that means, I can treat any skin tone from very dark to very light. With darker skin patients, we'll need to pre-treat your skin with a pigment corrector, a retinol. Everybody, regardless of skin tone, has to wear sunscreen every day. But candidates who would not be best for this treatment would be people that are out in the sun a lot. If you have a history of really bad cold sores, we would need to pre-treat you with an antiviral medication, or patients who just don't have a lot of downtime. We have patients, of course, in Nashville that are high profile and they're jet setting all of the time and all over the place, and they just don't have a lot of downtime. So that's something that we really need to discuss during the consultation, is if you're a candidate because of the downtime with the laser. And in just a little bit, I'm going to walk you through my halo, the process, and all of my downtime, so you get kind of a good idea of what you can expect with your treatment. Now, as far as the pre-treatment goes, for patients who tan very easily, have brown eyes, they rarely burn, dark brown eyes, dark hair, patients that fall into that category, you'll need to pre-treat your skin. Pre-treating the skin is necessary. I like to do it for at least 4 to 6 weeks before the halo, because that's going to cut down on the complications of pigment changes. So what happens is during the laser treatment, the cells that make your brown spots become super excited. They want to see what's going on the surface of the skin, and they can just hyperproduce. Depending on what's going on with your skin, we might take pigment out of your skin, although that's very rare to happen. And I've never seen it with any of my halo patients, but we want to stabilize the cells that make the brown spots, which are called melanocytes. I need you on a pigment corrector that's going to basically make those cells very sleepy and sluggish. We want to slow down the production of them. We also want to start fading the brown spots that you see on the surface of the skin, because that makes the halo or BBL, if we're doing that too, it makes it work better. So the pigment corrector is necessary to stabilize the cells in your skin. The retinol enhances everything. It will jumpstart your collagen production. It just makes your skin so much healthier. It tolerates the treatment better. Your results are so much better. It also accelerates the work or efficacy of the pigment corrector. So they work hand in hand. We need you to be on one. If you've not been able to use retinol in the past, there are tips and tricks that we can teach you to make it a lot more tolerable. We can find a good retinol for you, but those two are really necessary in pre-treating for the halo. And then for any skin tone from very dark to very light, you must wear sunscreen every day, because that's going to protect your skin from sun exposure and also prevent future damage from coming. So let's talk about and walk through a demo of my halo. So this is going to be a time-lapse video for you to see, just for time reasons. So basically what you're seeing is the halo laser itself. So I am sucking on the Pronox laughing gas tube because my pain tolerance is very low. Although I have no anxiety with these treatments, I just have low pain tolerance. So the laughing gas is the same that they do in the dentist's office. It's going to be administered differently. So instead of like the nasal cannula or something like that that they have on you, you're breathing it in kind of like a snorkel tube. So you're inhaling and exhaling through the tube, and that's allowing the gas to get into your body to reduce anxiety and discomfort. The success of your pain control and anxiety control is going to be on how you are breathing in and out of this tube. And we give you full demonstration on how to do it at your appointment, but just know that that is really important for the success of your discomfort control. So the halo, this is an ablative and non-ablative laser. So the ablative part is what basically cuts your skin, and you'll see on my skin, you'll see the tiny little dots of blood. And those are just tiny little scabs that need to just heal on their own. And some people leave very bloody. Some people don't leave with any blood on them. It's just part of the treatment. So I got kind of bloody with this treatment, which is completely fine. On a side note, this is my third halo that I've had, and I usually get it done about every other year. So with this video, they're also applying PRP, which is where they drew my blood and we spun down the plasma and applied that on the skin. That just helps healing, make it go a little bit faster. It helps reduce some swelling and just gives a better result as far as collagen production. So now I'm going to walk you through what I look like after the treatment. So this first one is just going to be a little clip of immediately after the treatment when I got in my car. So the skin was starting to calm down a little bit. My discomfort was almost gone. It was very tolerable at that point. It just felt like a little bit of a sunburn. So that's immediately after the treatment. And then the night of the treatment, I have a picture showing here where it was in my bathroom. So it was a few hours after the treatment. The redness had calmed down significantly, and I really felt like just a mild sunburn at that point. So the discomfort is pretty much gone within the first hour or so of the treatment itself. Throughout the course of the treatment or the course of the recovery, your skin is going to feel really rough, like sandpaper. So it doesn't peel off and fall off. Like if you've ever done a chemical peel, your face just kind of falls off everywhere. This doesn't happen with the halo. Basically, the skin kind of hangs on until you wash your face and you just use your fingers, but just while you're washing your face with your fingers or you're in the shower, that textured sandpaper dead skin is going to come off at that point. So you're not going to leave it all over the place. It just comes off during cleansing. So that textured sandpaper pretty much lasts about 5 to 7 days on average. If you're doing the neck or chest, it can last a bit longer, maybe 10 to 14 days, but for the face, about 5 to 7 days. So this next picture is my next day. So I had this treatment on a Monday. So this was Tuesday morning when I came into the office. So I'm puffy. I had my face and neck treated. So my face is puffy and my neck is puffy as well. And then I have some little splecks of blood on my skin that it's completely dried, but it's just kind of scabbed up. So that's next day. And then Wednesday, still swollen. My neck looks a little bit better. My redness looks better. But pretty much I think that day was my worst of swelling. And I tell patients that you're going to be intensely swollen for about 3 days. The next day stinks. The day after that is typically the worst. So just kind of keep that in mind, 3 intense days. And then the following day, which would be, I guess, technically Thursday, swelling much better. Also, I had the PRP, so that did help with my healing time. So swelling much better, little red flecks of blood starting to get better, still a little bit pink, but not as bad. And then the following day, all the little red spots, the blood spots are gone. My swelling is almost back to normal, and I'm just still a little bit pink. At this point, I could put makeup on if I wanted to, but I usually just tell people wait until your skin gets back to normal before you put makeup on. And then this last picture is the following Monday, so exactly 1 week after the halo. And I do have on just a little bit of a tinted sunscreen, no actual face makeup, but everything is pretty much back to normal at that point. So this is just kind of a guideline of what to expect with the halo. Popular parts of the body that we do this on. Face is, of course, the most popular, followed by the neck, the chest. We do a lot of hands, and then I also do quite a bit of lower arms as well. Just know that whenever we're doing areas like that, I oftentimes like to do a BBL at the same time just because it's going to enhance the results. So hopefully seeing my process of the halo has been helpful for you. And the next segment we're going to talk about in just a moment is going to be about BBL, which stands for broadband light, and that will be up next. All right, so we're going to be talking about BBL next, and BBL stands for broadband light. So BBL is, like I said in the previous segment with Halo, BBL is branded through Saiton. So the BBL technology is actually IPL, or intense pulse light. So IPL would be like generic cola, and then BBL is branded like Coke or Pepsi. So when somebody comes into the office and they say, I have an IPL, or I've had a history of IPLs, that could be lots of different machines, but if they tell me they've had a BBL, then I know that they've had the Saiton device. So BBL is really the world's best pulse light treatment. It gives incredibly consistent results. The results are fast, effective, they're very safe as long as we follow the strict parameters of skin tones and settings and things like that. But we have such amazing results with our BBL that it's really my favorite go-to treatment for patients with sun damage or excess brown pigment they want to reduce, redness. It's a great treatment for acne, rosacea. Those are great treatments for rosacea as well. So BBL is excellent in any kind of anti-aging program as long as you're a candidate for it. So what we treat with BBL. The primary treatment target is pigment. So that's either brown pigment or red pigment. And red pigment also includes broken blood vessels, specifically along the face or neck area. We don't treat vascular areas like on the legs with BBL. Those are different lasers and different treatments, but primarily facial vessels are what we also treat with BBL. So while it targets pigment, that's its primary goal, it also is an anti-aging treatment because it stimulates collagen production. So how that works, BBL is pulsed light. So that's going to be a flash of light into the skin that's targeting the pigment. It's either flushing the brown pigment to the surface of the skin or it's contracting the red pigment down, but it's addressing your pigment. But there's also heat produced with BBL, and that heat is what's going to stimulate the collagen production. So it's excellent for anti-aging in working on the texture of the skin, softening fine lines and wrinkles. Patients say they just have this really pretty glow with their BBL, and that's without doing anything else like lasers or like the Halo. So BBL, excellent for those things, primarily pigment, but also anti-aging. Now, if you've never had a series of BBL before, or even IPL in the past, most people need 3 treatments on the area that we're treating. So if you want to work on your face, your neck, and your chest, you're going to need to plan on doing 3 treatments. Now, they can be done at the same visit, so all 3 in one visit, and then the second visit and the third visit, but you will want to plan on doing 3 treatments. The reason for that is we're not going to be treating all of the pigment at the same time. We're going to be able to reduce probably a good 50% or more of the pigment that you see, but pigment is deep. It goes down into the depths of the skin, and so we need to treat the deeper pigment. We need to treat the deeper vessels. We want to continue stimulating collagen. So you do need to have those 3 treatments in order to give you the best results. Are we going to get rid of every single spot or every single blood vessel? No, absolutely not. But by doing those 3 treatments, it gives us the best outcome that we can achieve. Can you do more than 3 treatments? Absolutely. For rosacea patients and also patients with a lot of broken blood vessels, we might need to go into 4, 5, or 6 treatments because it's a different kind of issue than just plain old good fashioned sun damage. So we might need to do more treatments. After you go through your first series of 3 treatments, though, if you're just regular sun damage, anti-aging, then you can expect to do at least 1 treatment per year. And that's going to be your maintenance and also prevention of future aging. Now, the candidates for BBL, this is where it gets a little bit trickier with skin tone. And we're going to insert a little skin tone type chart for you to look at. But basically, people are broken into 6 skin types. It's called the Fitzpatrick skin type scale, and it's 1 through 6. And this is going to help decide if you're going to be a good candidate for BBL or not. Traditionally, patients with very, very dark skin cannot have a BBL. The reason for that is we have significant hyperpigmentation or transient depigmentation issues. So with very dark skin, we could make your skin darker. So if we're working on your face, you could have dark patches on the skin where we've been working. Also, we could do what's called transient depigmentation, which means we're basically removing the surface skin tone. your skin tone will come back over time, but it's going to essentially leave you with what would be white patches on your skin if we treat you. So definite contraindication, dark skin tones. Typically Fitzpatrick tones 1 through 4, I treat very, very comfortably. Fitzpatrick tone 5 can be a little bit questionable, where we have to do a lot of pre-treatment for the skin, but Fitzpatrick 6, which is very dark skin, we cannot treat with BBL. The other issues that we have with BBL as far as candidates, sun exposure is a huge problem with BBL. Now, it's a big deal with halo, but with BBL, we need you out of the sun for at least 2 weeks before a treatment through 2 weeks after a treatment. So that's about a month, not in any kind of direct sun. Now, that does not mean in and out of a car, in and out of an office, something like that, but basically 30 minutes or 45 minutes outside without sun protection is your maximum. I essentially don't want you to come in or leave and get an active tan or an active sunburn. So any kind of excess color on the skin, whether it's brown or pink, huge contraindication. What happens? You could have burning, blistering, scabbing, and then that's going to cause a lot of pigment issues. Some of it can be scarred, and that could be permanent. So your sun exposure is really important. You don't want to fly in from the Caribbean and come in and do your BBL and then leave and go do something else, because even though you might have a hat on and sunscreen and all of this stuff, you're still going to be out in the sun and getting sun exposure. So that's why we like to do these specials and really push for Saiton treatments in September, because you have all of fall and winter and very, very early spring that you're able to hopefully fit in these treatments. So sun exposure, big issue. The next one would be fake tanning or spray tanning, sunless tanning, the creams that you can put on your skin. Those will make the skin look a different tone than it is, and that can also burn and blister the skin. I like to tell patients to not use any for at least 4 weeks before the treatment. I know sometimes those tans fade away within a few days, but I never really know if the tan is still active or not. So I prefer to wait about 4 weeks before doing a treatment after you've done some sort of fake tanning. If you have a history of cold sores, that can also come out during these BBL or halo treatments. So you need to let us know so we can send you in an antiviral medication to help prevent those outbreaks for you. Now, I'm going to go ahead and walk you through a BBL treatment. So this one was done on a face, and she has eye protection on, and we do ultrasound gel. So the ultrasound gel is for 2 reasons. One, it's going to allow us to glide and slip the device easily across the skin. And then it also helps to cool the skin down because there is heat involved with BBL. So the gel acts kind of like what aloe vera does with a sunburn. It helps the heat to escape out and cools your skin down easier. So that you're going to see this kind of stamping across the skin. With the BBL, which is different than the halo, you're going to see that bright flash of light that I told you about. So that flash of light is going to be startling. You'll have goggles on, but you're still going to see some of the light come through the goggles. So just know that there is going to be a lot of light that you see. The eye protection is there, obviously, to protect your eyes from the flash of light. Now, I'm going to show you some downtime. So this is something you also need to be prepared for. Remember when we talked about the halo, you're going to have at least 3 days of intense swelling and then flaky skin for about 5 to 7 days on average. That is pretty much guaranteed. I've not had any patients that have never had one tiny little bit of that. Everybody has had some swelling. Everybody has had some flaking. BBL, this is very different. It's almost like a toss of the dice. I don't know for sure if you're going to have some of these side effects or symptoms, so I need to prepare you for them. When we're working on excess pigment, so freckling, sun damage, things like that, you can expect your brown spots to get darker. Now, the brown spots will get dark and they're at their peak at about day 2, and then over about 7 to 10 days, they start to fade away. Unlike halo, where your skin flakes off, nothing happens with the BBL. You will not have any flaking or peeling or crusting, nothing. The brown pigment will just microscopically shed away. You don't see it happening. You can sometimes feel a little bit of the texture, but it's not going to be able to be scratched off. So just know brown spots get darker and then they fade. This doesn't happen with every patient because if your brown spots are closer to your natural skin tone, they may not be as dark as what you're thinking. So just know they do darken. It might not be extensively darker, but they will darken and then they lighten. The other thing that is a potential is swelling. And I'm going to show you two different patients who've had BBL only. And one, you can see all of her peppering on her skin. Actually, both of them, you can see the peppering. But the first one, you can see all of her peppering, but you can't see any swelling. She just looks pretty much normal. She might have a little bit of puffiness under her eyes, but for the most part, you really wouldn't be able to tell that she's had something done. And the next patient, she had a lot of redness in her skin along with the brown pigment, and she swelled up a lot. So with the swelling, it is hit and miss. You might swell, you might not. If you swell, it's typically going to look like maybe you've been up crying all night and your eyes are a little puffy, or you could be just kind of chipmunky across the cheeks. That can last 1 to 3 days, 4 to 5 days on average. So I would say socially, don't plan anything important for at least 5 to 7 days because you don't know if you're going to swell or not. Now, with BBL, unlike halo, I don't care if you wear makeup right away. You could leave our office and put a full face of makeup on and go and do whatever you want because your skin isn't broken like it is with the halo. So you can put makeup on if you need to. That can definitely help with some of the brown pigment that you see. Obviously, it's not going to help with any swelling, but it can help with some of that brown pigment. So makeup is absolutely fine to use. The other things that can happen with BBL, if we're working on a lot of broken blood vessels, then some of the energy could just be too much for those tiny little vessels on your face, primarily on this cheek area. So a tiny little blood vessel might pop or burst and cause a small bruise, and the bruising can last usually a few days, sometimes up to 7 to 10 days, depending on the patient and how fast you heal normally from bruising. Again, makeup can be worn to help cover that bruise up if needed, but just know that that's a possibility as well. Now, for BBL, the most common areas that we treat, face, of course, again, neck, chest, back of the hands. I do a lot of lower arms, upper arms. I do a lot of backs, lower legs for a lot of the brown pigment. I just want you to know that when you're doing brown pigment on the arms, legs, back, you oftentimes run into some other type of pigmented areas called seborrheic keratoses, which are more of a thickened skin cell, and those oftentimes have to be either lasered off, frozen at your dermatologist's office. They can be burned off sometimes with a cautery device. But do know that the further away from this midline you get, arms, backs, legs, you might not get the same type of result that you'll get on this mid face, neck, chest area. So the results really vary significantly on the upper arms, the backs, the legs. So definitely we'll talk about that in your consultation, and I'll be very honest if I think it's going to help or not, but just know you might need to have other things done if you have those seb-Ks on your skin. I think that's probably it with BBL. I think the next thing we'll talk about will be the Nano Laser because that's new to our packages this year. We've been doing Nano Lasers for years, but we've included it in one of the packages, so we'll talk about that next. So a new addition to our packages this year is the Saiton Nano Laser. Now, I've been doing Nano Laser for years and also Micro Laser. I'll just kind of briefly talk about the two of those, but that's new to our packages this year. The reason I'm adding the Nano Laser in is because basically it's going to give you kind of like a microdermabrasion or light chemical peel result without using the abrasiveness of microdermabrasion or the chemicals involved with a chemical peel, which I don't have a problem with either of those, but it's just a nice addition for this package. basically it's going to polish off the skin. So when we're doing BBLs, which is part of the package this year, the Nano Laser is going to come in and just polish off the top of the skin. So that's going to help with remaining texture, remaining little brown spots. It's just going to help with the smoothness and softness of the skin. So just think of it as a nice deep exfoliation. It's going to have no discomfort at all. I do the Nano Laser on myself quite a bit. And I told you earlier, I have a low pain threshold. So I do the Nano Laser myself. I don't have any discomfort with it at all. And it's just going to be a really quick treatment to add on to the BBLs. You will expect a little bit of downtime with the Nano Laser. So your skin will look pink, kind of like a sunburn, and it's going to kind of feel like a sunburn. So if you were to go out into the heat or get into a hot shower, then your skin is going to flush and get really warm, and then it's probably going to peel and flake for several days. And that's pretty much it with the Nano Laser. I can customize it to go a little bit deeper, a little bit more shallow, but a Nano Laser is essentially only removing 4 to 8 or 10 microns of skin, which for reference, a micron is itty bitty tiny. A sheet of paper is 100 microns. So 4 to 8 or 10 microns removed with a Nano Laser is really going to be very mild and gentle on the skin. If we do something deeper, it's called a micro laser. That's going to remove about 10 to 50 microns of skin. The downtime is going to be a lot more significant. That's not part of the package, but we do offer that as well. And it really does help with just a lot of textured skin. So the Nano Laser is going to be an add-on to our treatments this year. Anybody can do it. We don't really have any problems with skin tones, contraindications, complications. Like I said, it's basically like a microdermabrasion or a chemical peel, just using a laser. And it's a really, really nice add-on to do really for any BBL or halo. So that will be kind of the last treatment that we talk about today before we move on to some of our combining treatments.
Hi everyone, I'm Olivia. I'm a nurse injector here at Cool Springs Plastic Surgery. And today I want to talk to you about our laser specials that we're going to have for the month of September, and more specifically how you can use lasers with surgeries. Specifically facelifts, neck lifts, and blepharoplasties usually benefit from having a laser at the same time as surgery. A lot of people will think if I'm getting a facelift, that's going to address every concern I have on my face, so why would I even need a laser? But the truth is they address very different things. So your facelift is going to address your laxity. So when you've got loose skin along the jawline or in your neck, it's going to tighten all of that up so that you've got a sharper look. A lot of the time they'll add volume at the same time as a facelift, maybe facial fat grafting, and that gives you volume restoration if you've hollowed out anywhere. But neither of these things address your skin quality, so that's where lasers come in. If you had a facelift without a laser, you're still going to have the same brown pigment, broken blood vessels, texture, wrinkles, and dull skin tone that you had before the surgery. When you add a laser with your facelift, you can address really all three main signs of aging at once. The facelift will address the laxity. The fat grafting, if they do that, will give you back volume, and then your laser resurfaces the skin so that you have a smoother look as well. Lasers can also help you maintain your surgical results because they boost your collagen and elasticity, and they keep your skin healthy. So that tight skin that you got from your facelift is going to last longer and stay tighter for a longer period of time. We often do the laser at the exact same time as surgery, and I normally recommend that just so you can have one downtime and not have to do that twice, because lasers do come with downtime just like surgery does. But if that timing-wise doesn't work out, you can do lasers later, of course, as well, once you're healed from surgery, and work on your texture at a later date. Either way, unfortunately, anti-aging is not a one and done. So you're going to have some kind of skincare regimen in place to maintain that result that you've invested a lot of money in. We also do lasers with our non-surgical treatments, so Botox and fillers. Christy's going to get into that here in a little bit. But all of our laser specials are running for the whole month of September. And if you're not sure what you need, just give the office a call and we'll get a consult.
Hey guys, my name is Chrissy Hanley. I'm one of the aesthetic nurse injectors here at Cool Springs Plastic Surgery. I'm at our Franklin office the majority of the time, but on Mondays I'm at our Brentwood office where we keep our lasers. So I have a background in dermatology, so a lot of times I will recommend skin treatments or lasers for my patients when we do injectables. The reason why is we know that there is multiple contributing factors when we think of aging. So with injectables, we can target a lot of them, but a lot of times it's best to do both, injectables and lasers together. So a common area that I recommend resurfacing treatments for in combination with injectables are what we call static lines. So anywhere on your face that the muscle is causing or forming a line and it's there at rest, even sometimes after we do Botox. All Botox is doing is relaxing the muscle, but if the skin already has that line etched in it, that line might not go away completely the first time. So Halo is our resurfacing laser, which is really great for those lines. It also stimulates collagen, so if you're just wanting to prevent those lines from forming, it's a really good option. I try to do one once a year, just keeps collagen stimulating. So a lot of times for my patients that just want to prevent or kind of age gracefully, I think that's a really great option for them as well. Around the mouth is an area that we don't want to put a lot of filler using injectables, but if we can treat the area with a resurfacing laser first, we can improve the skin so that the lines aren't as deep and use less fillers to soften the lines and restore the structural support to the mouth. Under the eyes is probably one of the most common. People a lot of times want to treat that area with Botox or with filler, but we know it's best to target all three contributing factors. So the muscle creases the skin, which we can relax with Botox. That will help improve crow's feet, so what we call lateral canthus lines from here over it. Botox is great for. We can also restore the volume, which will help with the deep shadowing or the hollowness under the eyes. But a lot of times it's the skin under the eyes, which is the thinnest on our face, that needs to be resurfaced. So Halo is an excellent option for that. Moving down the face to our neck and chest, that area is so vulnerable to the sun and the skin is so thin there. We see a lot of photo damage, so red, broken capillaries, brown, spotchy discoloration, and superficial textural changes. So that area is really excellent area to treat with a resurfacing laser like Halo or Bbl to improve the red-brown discoloration. Those treatments can actually be done together at the same time, because oftentimes we do have textural changes in the skin where we see red and brown spots. Bbl can also be done on the face, so if you have red or brown discoloration, we can treat that as well. So we're entering into what we call laser season, because it's about to become the winter months. So you want to have or avoid sun exposure before and obviously afterwards. So this is a really good time to buy your lasers treatments, and you can get them on sale this whole month. So if you're not sure what treatment you need, I'd love to sit down with you or any of the providers to really assess your skin and create a treatment plan specifically for you. So hope to see you soon.
Okay, so I think this is wrapping up our time together. Hopefully you've had lots of information that you've gathered, but Annalise is going to ask some questions. She's pulled these from Instagram and other social media avenues, so she's going to ask a couple of questions, and then I'm just going to go ahead and answer them. So what do you have?
Awesome. So the first question I have is, are Bbl laser treatments safe for melasma patients, or could this make the condition worse?
So if you remember, Bbl is not a laser, it's pulse light. So Bbl actually can make melasma worse. It's somewhat controversial in the aesthetic community. Some people say that it can make it better. Some people say it's unchanged. I follow the camp of I'd rather not take much of a chance to do it, because the heat is what can flare up the melasma. So I do have settings for melasma that I've been kind of playing around with over the past probably 6 to 8 months, and I'm not seeing huge changes in it. I would rather avoid BBL for melasma. We do have other treatment options. Halo is excellent for melasma. And then we also have a chemical peel treatment called the reverse peel. That's through our Skin Benefit line. And that was designed specifically for melasma and brown sun damage. So a combination of the chemical peel and then at another time, the Halo would be an excellent treatment for melasma. But BBL, I don't like to do it.
Awesome. So what is the best laser treatment for fine lines and skin texture improvement?
So with texture, I like to do the Halo because it essentially kind of burns the skin off, you know, for lack of a better, you know, reasoning. But I think Halo is going to be the best option for that. Remember, BBL is going to also stimulate collagen. So if you have brown spots, BBL is a good option to do because it stimulates collagen. But if you're really working on fine lines, you know, mild wrinkles, textured skin, I think the Halo is going to be the better option.
Perfect. So next question, which laser treatment is best for acne scarring?
So acne scarring, I'm going to go with the Halo because it's going to penetrate deeper into that fibrous tissue to help kind of break up those anchors that hold the scar together. It does help to resurface and retexturize the skin to help those divots, whether they're rolling scars or box scar or ice pick. It does help soften the edges. With acne scarring, a lot of people get kind of confused about that because somebody will come in and say, I have these acne scars, and it's actually the pink marks left over from breakouts. The pink marks are not scars. They're called PIH, or post-inflammatory hyperpigmentation. So with that, it's pigment. So if you have pink pigment in the skin, BBL is going to be a better option for that. But if it's actual scarring, I would prefer to do the Halo. We have other options too. Microneedling is great for acne scarring, both with the pink pigment and the scars themselves. And then chemical peels really help with the pigment as well. So we have lots of options, but if it's true scarring, Halo. If it's the red pigment left behind, the BBL.
Awesome. Thank you. And so one question we got was, which laser is best for deep wrinkles?
So deep wrinkles, we are a plastic surgery office. So if you have deep wrinkles and laxity, we'll be very honest if we think that a non-surgical approach is not going to work. We have 2 board certified plastic surgeons that are excellent. We might refer you for a surgical consult to have a potential facelift or neck lift. So keep that in mind, that deep wrinkles may not be addressed non-surgically. Non-surgical options, we have the Halo, which I think would be your better option for the deep wrinkles, or for a more aggressive approach, you would see one of our surgeons to do the TRL, which is a fully ablative laser through Saiton, or the CO2, which is also an ablative laser. And those are done in the OR with our doctors, so non-surgical providers can't do those. So Halo for seeing one of us. Next laser up would be TRL or CO2, and then the next step up from that would be a surgical consultation for a potential face or neck lift.
All right, perfect. And another question we got was, which treatment could be best for sun damage?
So sun damage comes in pretty much 2 different types of pigmented tones. You can get a lot of brown pigment, and you can get a lot of redness with sun damage as well because it's destroying the vascular nature of the small blood vessels. So if it's pigment, I'm going to recommend the BBL. If it is textured skin, like those seborrheic keratoses we talked about in one of the previous segments, Halo is going to be good for that. I would say for a true ultimate skin rejuvenation, I would do both, the BBL and the Halo at the same time. So you're working on everything. The pigment with the BBL, stimulating collagen, which is going to help with the fine lines and wrinkles with the BBL. And then the Halo itself is going to kind of retexturize the skin and go in and work on deeper sun damage, which gives really the better result. So both of those for, I guess, sun damage.
All right.
Yeah.
And my last question is, can you still get laser treatments even if you have overly sensitive or reactive skin?
So sensitive skin is typically because your skin barrier is damaged or weakened. That can be because of environmental issues, genetic issues, medications you're using, sun exposure, products at home. Those can all weaken the skin barrier, which increases sensitivities. Now, if you have reactive skin, as in you're allergic to everything, then nothing is really put on the skin except light or laser with BBL or halo. So the only thing you're going to deal with is the histamine reaction afterwards, where you'll have some swelling. As far as sensitivities, as far as, well, my skin just is sensitive, that's not going to really be a problem because everybody is on the same playing field with BBL and halo. So whether you have super strong resistant skin or super reactive skin, everybody's kind of the same with these treatments. So I wouldn't be concerned about that. Mention that during your consultation with one of us as providers, and then we'll just make note that we might need to give you a different kind of prep treatment, maybe recommend an over-the-counter medication to take ibuprofen or something like that beforehand. But I haven't had any problems with patients with overly sensitive skin not being able to do BBL and halo because, like I said, everybody's on the same playing field. So does that help?
Yeah, thank you so much.
Perfect. Well, I want to go ahead and get ready to sign off here in just a moment. Thank you so much for watching. I hope that you guys have learned a lot from this. We will be having our specials the entire month of September. I think they're going to be, are y'all putting some online? Like some of the packages will be online, which was really popular last year. So you can purchase things online. If you see a package online that doesn't fit your needs, then just call the office and they'll be able to find the right package for you, because we do have a lot of different options. And if you have any questions, just let us know. Any of us that do lasers or BBL treatments, set up a consultation, make sure this is right for you, do your research. We have tons of before and afters on our websites and on our Instagram pages, so you can kind of get an idea of if this person that has a similar skin tone and similar issues, what their results were, and that could hopefully be a result similar to what you guys can get. So thank you for watching, and we'll see you next time.